As Magnus has alluded, it's a very multifactorial disease. We don't have a typical biomarker to diagnose it, and therefore a couple of years ago the group of Daniel Schoskes and Curtis Nichols, they came up with the phenotyping idea. Phenotyping because these patients have a variety of signs and symptoms, and they grouped these signs of symptoms into 6 different domains, which they called the UPOINT classification system. The urinary domain, a psychosocial domain, organ-specific domain, infection domain, but not meant the chronic bacterial prostatitis, other signs of infection, for example, if you have ureaplasma or something which is not qualifying for a chronic bacterial prostatitis, then neurologic systemic domain conditions and tenderness of the skeletal muscles. And this group could show that the more these domains are present, the higher is the symptom burden measured by the NIH CPSI score. Therefore, it's very important to have this tool, a CPSI questionnaire, also translated into Swedish. Now, we have, together with a group from Italy, also looked into that UPOINT or UPOINTS questionnaire, because we have added a 7th domain, sexual dysfunction domain, in a group in our cohort of 1,200 patients with a chronic prostatitis or chronic pelvic pain syndrome. And as you see here, these different domains are very frequent, not only one domain present, but more than one domain present. For example, in our cohort we found the presence of urine domain being present in 65% of patients, psychosocial, and 35% organ-specific, 84%, neurologic 41%, tenderness 62%, but also sexual dysfunction was almost present in half of the patients. And this slide is to show you how this can be used for management. So, for example, if the urine domain is positive, then you could treat the patient with alpha blocker, antimuscarinics, or even pelvic floor relaxation therapy. If the psychosocial domain is present, and we in our department use, for example, questionnaires, depression questionnaire or anxiety questionnaires, then you can maybe treat the patient with antidepressives or use psychosomatic therapy. If the organ-specific domain is present, that means if there are signs or symptoms of inflammatory reaction, then, for example, these patients could be treated with pollen extract. Neurologic domains, if these are present, then also antidepressives or gabapentinoids could, for example, be used. And for the tenderness, physiotherapy, a dedicated physiotherapist is very important to use in this type of patients. And if you have sexual dysfunctions present, then, for example, depending what kind of sexual dysfunctions are present, PD5 inhibitors or testosterone substitution could be one of the treatments included. The next patient is 43 years. He complains of pain in both testicles, in the urethra, radiating to the perineum. He's married, has 2 children, has also medium-sized of urinary problems. The CPSI score was 11, 1, 12, so the total score was 24. In the 2-glass test, in the inflammatory part of the 2-glass test, the first urine, but also the expressed prostatic urine, had a high degree of leukocytes present, so there is a strong signal that this patient might have an inflammatory reaction. In the microbiology, again, there was no signal of infection. And in the ejaculate was sterile. Also PCR evaluations were sterile, but the patient had azoospermia, had a which was probably only incidentally. IAEF was normal, and there was no abnormal sign in the depression or anxiety scale. Uroflowmetry was normal, and residual urine was 40. So this is the transrectal ultrasound. So this is an incidental finding. We would not do anything with this finding currently. So in diagnosis, this patient has inflammatory chronic pelvic pain syndrome or chronic prostatitis. The domains present would be the urinary domain and the organ-specific domain. So if we want to treat these 2 domains in parallel, for example, appropriate approach would be to put this patient on an alpha blocker and an anti-inflammatory medication with a pollen extract for 6 months at least.